Thank you very much, Mr. Chairman. Ohio. Good morning, ladies and gentlemen. It's a great pleasure to be here and to talk to you today. The presentation on antimicrobial resistance and the approaches at global and national level. So let me just, especially for the human health side, introduce very quickly the Food and Agriculture Organization of the UN. You possibly know the World Health Organization, but this is another specialized agency that deals specifically with food and agriculture. So it's beautiful headquarters in Rome and also the regional office in Bangkok. So when you come to Bangkok, please come and see me and I would be happy to show you around. So the FAO has offices worldwide, and these are the regional offices and the offices specifically linked to animal health that were set up following the global threat of avian influenza H5N1. We further have 90 country offices, and our direct interlocutors are the ministers of agriculture. So the mission of FAO is to build a world without hunger. And you have heard quite a lot already about the Sustainable Development Goals. But here, clearly for FAO, we very much work towards global the goal number 2, which is no more hunger, but also other goals where we are very much involved with, for example, 1, no poverty. And then we deal also with gender equality. Climate action is one of the important ones, but also the one on responsible consumption and partnership, etc. So just to bring you back to give the global perspective, we see the enormous growth in the human population. And if you see the difference between the developing countries and the industrialized world, most of this growth will take part in the developing world. So the urbanization, and having moved to a city like Bangkok, it's fascinating to see how urbanization is growing and how life is being adapted to this urbanization. But if we look at projections by 2025, we see that many of the megacities, and a megacity is defined as a city more than 10 million inhabitants, will be in the area in Asia, and Tokyo clearly one of the biggest city. But with cities also come every person needs to eat every day. And if we look at the consumption, food consumption per capita, and these projections show that especially in East and Southeast Asia, and here we have to see also the role of China, the growth in consumption is even outpacing the average in the world. While we see in South Asia, it is below the actual world average. And with the increased demand for animal-sourced food, we also find that there is an increased intensification. And with intensification, also the use of antimicrobials. So just to show you a little bit the changes in consumption, and this is quite a big table, but if you concentrate, for example, if we look at pulses and some other dry food, we see that actually the consumption is decreasing. But if we look at meats and milk, dairy products, there is it's almost doubling in the years to come. So if we now compare South Asia with East Asia, we see that there are big differences. And here if we look at meat and milk consumption, while in South Asia the milk consumption is growing rapidly, we see that meat consumption is much less compared to East Asia. So understanding these different regional consumption trends are important to also see how the production is growing in the different areas. So my predecessor just presented also on this figure of the 10 million people that will die if nothing happens with regards to diseases linked to antimicrobial resistance. So I think we like the same slides. So here also to show the complex interactions and the need for this close collaboration between the different sectors. Because we often see that, for example, within the ministries, agriculture, aquaculture, animal production are in different departments, or in some countries even in completely different ministries. And to have this collaboration is not an easy task. And what we're also finding more and more that we are looking, that even antibiotics are being used in crop production, and especially with regard to citrus fruits. So not only 2016 was an important year, but I think we even can go back to 2015, which laid the basis for the many activities that were developed in 2016. And here to mention the Global Action Plan that was developed by the World Health Organization and adopted by the World Health Assembly in May 2015. In this Global Action Plan, also the contribution of the OIE and FAO were clearly spelled out. And this brought together also this tripartite action. So even Dr. Margaret Chan, the Director General, she also mentioned the One Health approach as part of this Global Action Plan. Then just in the same month, the OIE in their general session adopted also a resolution on AMR, and 1 month later in the FAO, when every 2 years the ministers of agriculture of the member countries meet in Rome, in the governing conference in June 2015, there was a resolution on AMR, and after that FAO developed the FAO Action Plan. So how the contribution of FAO to the Global Action Plan developed by WHO. So as previously mentioned also, the General Assembly was a turning point. It created incredible attention to the need of countries to address. And as mentioned, it was the first time a One Health issue was addressed in the General Assembly, but it was only the fourth time that a health issue was addressed. The first time was HIV, the second time was non-communicable diseases, and the third time was Ebola, and the fourth time AMR. So it shows that also the world leaders are becoming more aware about the problem of antimicrobial resistance. So also here the mention of this need to coordinate between the different sectors, the human health, the animal health, and the agriculture was clearly stated. And the commitment for the countries to develop the national action plans. And also, as mentioned, Japan is very much on the forefront. But all the countries are supposed to finish their national action plans by June of 2017. So we see around the world many countries now engaging and developing this action plan. But one of the issues that we have found in several countries, that while the Ministry of Health is very much at the forefront of developing this action plan, often the agriculture sector is lagging behind. The Minister of Agriculture might sign or will sign the action plan, but often there has not been enough involvement and consultation with the agriculture, and especially the animal health sector. And this is something that we are trying to develop with several countries, these kind of stakeholder consultations. While it was mentioned that, for example, the Netherlands is very low on the consumption of antimicrobials or the use of antimicrobials in human medicine, but if we look at the animal side, the Netherlands in Europe was scoring like one of the highest, where there was a lot of consumption of antibiotics, specifically in the production of pigs and poultry. So through the stakeholder consultation, getting the private sector, the public sector together to discuss the issue of how to reduce the use of antimicrobials was very important to get the sector involved and recognize the needs to reduce. And I think the Netherlands has been quite well in reducing considerably, but still it's not enough. So if we look at the different elements of the Global Action Plan, and it's very much reflected in the Japanese Global Action Plan, we see that creating awareness is one of the pillars. And if you think that also in the sector, and especially I'm talking to the veterinarians, when you talk to farmers, they often say, well, you know, they know what antibiotic residues are. This is a term that they know because the food is inspected and is measured that there are no more residues. But resistance often is not understood. And also here we need to do more awareness among the veterinary practitioners, but also about the farmers to know that it's not only the appropriate use that you keep the withdrawal time before you take, for example, the animal to the slaughterhouse, but actually to decrease the use of antimicrobials. So then the second pillar is very much about surveillance and enhancing laboratories. And in especially many developing countries, we see with influenza and pandemic threat, there has been a lot of strengthening of the virology laboratories. And often manpower have shifted to these virology labs, but the bacteriology labs are very much understaffed, under-resourced, and often with no new equipment. So this is very important if you want to set up a good surveillance system to have your sample collection, but also to be able to process them. So if we look at the part of to reduce infections through better hygiene and infection prevention management, on the animal health side, there is a lot that we can do. There's a lot how we can actually reduce diseases by better practices, but also increase the biosecurity on farms, but also the treatment of animals to, if you are able to diagnose properly the diseases instead of just giving a broad spectrum antibiotic. I've worked many years in Africa, and for example, tetracycline long-acting was like our only tool that many of the veterinarians had, and any animal that was sick just received one shot of tetracycline long-acting. So there is a lot to be done on how to prevent diseases and how to control them better. So vaccination is, for example, another way of preventing disease and preventing the need to use antimicrobials. Another issue is to optimize the use of antimicrobials in human health and animal health, and then to ensure the sustainability, that there is enough research and investment and development to find possible other procedures or other medications. So if we look at the One Health collaboration between the three organizations, FAO is very much looking at the food and agriculture sector, and OIE is the leader in developing these animal health and welfare standards. And also the OIE has developed a database collecting information about the actual use of antimicrobials. And often this information is not readily available. Big companies are not always bringing forward actually the amount of antimicrobials that are being sold to the agriculture and especially animal production sector. But the numbers are just huge. And then clearly WHO is the leader on human health issues. Well, I just want to move forward and, within the different sectors that need to be involved. And if we look at the action plans, well, we mentioned the awareness and the practices, but also to gain the good evidence, because it's very difficult to talk to an audience if you don't have the data and the evidence. And here often, especially in developing countries, this is still a big problem. But also the governance. Countries need to have good legislation in place, but it's not enough to have the legislation on paper, but actually how do you implement this legislation? We, for example, see that there is a lot of counterfeit drugs in many countries around the world that are being used, and how to regulate that, how to be able to fight these issues are very big challenges. So to develop, again, going back to the National Action Plan, it's important to have the different ministries involved, but also to have the private sector, the industry, the decision makers, the laboratory expert, and also civil society. For example, we see that some of the big companies, the big animal production companies, are very sensitive to, for example, the press. If consumer groups are very voiceful, this can put pressure on these big companies to look into their actual use of antimicrobials and trying to reduce the levels. So first of all, the incredible work that needs to be done to raise awareness, and as mentioned also the Antibiotic Awareness Week, and I just heard that Professor Goossens was the first one who initiated that. Which year was it? 2008. And it's incredible how this has taken forward. And this year, the Antibiotic Awareness Week will be organized from 14 to 20 November. And I understand that in Japan you have actually a whole month. So this is fantastic, how this can give really important impetus. This year's theme that was kind of agreed between the tripartite was think twice. Think twice before, as a medical doctor, you prescribe antibiotics, but also think twice before you, as a veterinarian, prescribe the antibiotics, not only in animal production, but also in small animal practice. We see that many new veterinarians go more into small animal practice. And this is an area where a lot of antibiotics are being used. People live in close contact with their pets, and this is not often regulated in country because this is not seen as food production, and the ministries of agriculture not always regulate, for example, the use of antimicrobials in pets. So just to illustrate the complexities and the difference between therapeutic use and non-therapeutic use. Still in many countries, antimicrobials are being used as growth promoters. And we see, fortunately, that many countries are also banning this. So growth promotion is the use of low levels of antimicrobials regularly through animal feed. And if you see the amounts of animal feed where antimicrobials are being mixed in. But as mentioned before, also crop production. And what I want to stress is the environment here. We see effluents if you take samples from water, from the rivers, especially around cities, the number of resistant organisms is very scary. And this is the whole soup we kind of live in. And it's difficult to tell if it comes from animals, from humans, or from plant production, where this all comes together. We also have seen the use of antimicrobials in large quantities in aquaculture. And this is also an area that needs to be addressed. So just to finalize my presentation, I want to show you the different complexities, and we need to take what we call a value chain approach to see, for example, the manufacture of antimicrobials. Where does it go? Where are they being sold? Where is the retailer? Where is it the antimicrobials are being mixed in the feed? But also at the international level, where are the actual manufacturers, the mother country where these antimicrobials are manufactured or being imported. But this goes then into the different production systems. So here within the pig, poultry, cattle, buffalo, aquaculture, and each of these production sectors, again, have different kind of scale of production. So we find, the backyard, maybe there the use is much less, it's quite less, and sometimes it's almost inconsiderable. But the large and medium scale, the large scale, there might be easier to introduce other alternatives as biosecurity. But it's the medium scale that is very concerning, where often the farmers do not have the means to introduce new methods of better production. And then we see it all goes into the processing and marketing, and then in the end, the consumer. So understanding the whole value chain of animal production, I would like to stress here. And then the different actors. There are quite different actors there. There are the veterinarians, there are the producers, the traders. So also creating this awareness and to have the stakeholder consultation needs to take them all and all their interests and issues that are at stake into consideration. Thank you. So what are the possible solutions? Well, we need to understand, how can we ensure good manufacturing practices or good production practices? understanding the management and distribution networks, not only of antimicrobials, but also of the different products. And to see also which ones are registered for which animal species and what are the indications, and possible review them regularly, defining which are the critically important antimicrobials for human health, that they should not be used in animal health. And to also better understand the geographical location of where resistance is emerging, but understanding the different practices. So just mentioning again here the importance of having a good surveillance in place and the good information that is generating when you have laboratory capacity. And we have developed this tool to assist, for example, laboratories to assist in what stage they are and what are the next steps they need to improve their technical capacities. And just to finalize my presentation, just to summarize, in the animal production we have, the terrestrial animals and also the aquatic animals. So here the good practices, finding alternatives, finding ways how we can better control infections, working on prevention and not on cure, and less on cure. But also from an animal welfare standpoint, you cannot deny an animal that is sick the treatment. So there needs to be, the use of antibiotics. We cannot completely deny it in animal production, but we promote the stewardship, as it is called, the good use of antimicrobials, the responsible use. But also finding more and more the use of antimicrobials in crop production, which is often not regulated. Often the agriculture sector actually doesn't know about the use of it, for example, as I mentioned, in the production of citrus fruits. And I've even seen pictures of trees being injected with antibiotics. And this seems to be relatively more common practice than expected. But to have the good registration and the implementation of the legislation that you develop. And with this, I would like to thank you for your attention. Arigato.